All right, everyone. Welcome to another episode of Wellness at the Speed of Light podcast. I am your favorite orthopedic spine surgeon host, Dr. Stefano Sinicropi, and we got an amazing show for you today. This guy is like really fascinating. I've been following him, watching his profile. He's made a crazy shift. We're going to get all into that right now, but we're going to talk about why he's so passionate about helping you to navigate through the system. We're going to talk AI. We're going to talk all kinds of stuff. This is Dr. Asha Zimmerman. And welcome to the show, Doc. I really appreciate you coming on, and I think the audience is really going to enjoy this one.
Yeah, happy to be here. Thanks. I appreciate the invite. Looking
Uh,
forward to talking about some things.
and that's awesome. All right, so I think we just need to start at the obvious point. So you were a successful hepatobiliary surgeon, okay, which is not an easy thing to do. And
Yeah,
then
just
you,
just to interject, I'm mostly doing transplant. I was doing a little bit of
okay,
HPV, but yep, yeah,
okay. Well, transplant hepatobiliary. I mean, it's for the people listening, it's all complex.
yep,
I'm a spine
yeah, yeah.
surgeon. I'm like, that seems like that's really complex. Ooh, that's like a really complex deal. But anyway, you made the decision to basically leave clinical practice and go ahead and venture down the world of AI, which I am so passionate about, and I really want to, dive into that. What spurred you? Like how'd you first get into AI? When was the aha moment where you're like, man, this is so big, this can do so many great things. I'm just going to do that.
Yeah, I mean, it probably most people who probably knew me in high school and college knew I was kind of a nerd. So always involved with computers. But essentially, I went into transplant surgery to help people. For me, kind of, I'm sure you feel similarly. There's certain things that work well with your aptitudes, and you kind of just drift towards those, and it makes perfect sense. I also, in undergrad, majored in philosophy, and so some of my thought processes on the best way to help people were kind of rooted in that. And at a certain point, as I started getting involved with the language models as they were coming out, it became clear to me that there's an opportunity to create something that could help many more people than I could ever help as a surgeon. And the likelihood that we'll be successful is, I think if we're being realistic, low, but there's a real possibility. And when I think about it from a life perspective, I want to minimize my regrets in life. And so I don't want to be 80 and think like, oh, I could have built that
Yes,
thing. I should have
yes.
just pursued that. And so sometimes when you have a couple of, I don't know, somewhere between a hobby and an obsession that kind of combine and link, and you can do something really special with it. You kind of have to take a leap and try and pursue something. So it all started back in, I saw the demo for GPT-2 like before ChatGPT,
Wow.
and it was eye-opening to me what that was capable of, and it was kind of clear that this was going to be something interesting. And then when ChatGPT came out, at the time, I talked to my chair about it. I said, "Hey, I think this is like a really high potential
Mm.
to really change the way that we can um, increase the value of care delivery." And so she believed in me, and she got me an early kind of uh, little editorial piece. And so that kind of started things off. And then we started just doing research. As a transplant surgeon, no one really expects you to be that into AI research. But given that the field was so new, it wasn't too difficult to keep an eye on what the new techniques and modalities are coming out. Like you just have to follow archive on how to really squeeze the models and get a lot out of them. And so we started to get some real success. And we entered an accelerator at Dartmouth. We got about 50K for got like second place, and so we got 50K to start building. And then it started to get real, like where we were doing really well on performance benchmarks, and we kind of had this decision point where I either had to take it seriously or kind of abandon it, and I
Mm.
couldn't imagine kind of abandoning it. So that's kind of how I ended up here. And then, the weird part now is that like when you leave medicine and you have a startup, you have to kind of figure out a whole bunch of things which you never learned, like marketing. And I've gone through social media, and that's how we kind of connected. And so it's been an interesting journey and process, but it's fun, and I'm sure you know this, but when you're doing something that you're really passionate about, it's very easy to pump a lot of hours into it and not feel like work. So I'm having a blast. I feel like I'm, hopefully gonna be able to make a big impact if we can get this off the ground, and so that's kind of where we're at now.
Well, I love like everything you said. Like the one of the, I mean, you just hit it right on. I mean, this like regret minimization. It's like we should all be in the business for ourselves of regret minimization. As far as we know, we have one at bat at this thing. And if you have one at bat, like sitting around, I mean, it's a pet peeve of mine. I hate the word pet peeve, by the way, but I keep using it. But um, it's one of these things where people just keep waiting for some, like, I don't know what they're waiting for. When you have a true, passion inside, and it just needs to come out. I mean, just like you, I'm sure you get asked this question all the time, like, what in the world are you doing? You had a successful practice. You're taking organs from one person and putting it in another. I mean, that's all fancy stuff. I mean, folks, when you get in the elevator and the people have like that, like ice bucket, that might be something that the doc was putting in there. And to go from that to chasing your passion, I mean, people tell me I'm still a spine surgeon. I still do, a lot of it, but now I'm doing a lot in media. I have an upcoming speaking tour like this year. I'm doing all kinds of stuff. People are like, are you not like, why? Why are you doing that? I was like, because I actually feel fulfillment. And it really like it's deep joy. It's so easy to do, right? We're filming this on a Saturday, and this is what I do at my Saturday because I have a couple of these, and this is what I just love it, and I'm sure you feel the same way when you're doing it. You're in a flow state, right? Things are just happening, and then you're just like able to do it. You know, what do you think? Like, so do your colleagues that you not forget the people that are supporting? I'm just talking about just general colleagues. Were they shocked, or was this kind of the writing on the wall the last year? Or did you just walk in and say, like they do in the movies, mic drop moment, we'll see you guys later, I'm out of here.
No, I mean it was a hard conversation. So Dartmouth, we aren't like a huge transplant center, but there's two of us. We share call a lot. We got
Hmm.
pretty close. So my partner, who's also my boss, the division head, I had a conversation with him about a year before because it's hard to onboard someone, as you know, and you don't want to
Hmm.
leave a partner or friend with, basically a
Of
year
course.
of call. Transplant call is pretty brutal, and so I kind of, let him know that I'm feeling the need to kind of pursue this.
Hmm.
And so, he actually found someone who's probably an upgrade, to be honest, for the department, which is great. I'm a New Hampshire, like I grew up in New Hampshire, and so to be in New Hampshire, like it's great for the state to have such a good transplant center, and so to pick someone up really good. So in some ways, like everything fell together in a really perfect way, and it's kind of like you're talking about. Um, I was having fun in the operating room, but the rest of the stuff just wasn't lighting me up, and so like I think you really have to follow those signals, or like you're just going to wake up one day and be like, why didn't I just kind of do that thing that really lit me up? That the flow state's a perfect example. Like if I start working on this stuff, like 3, 4 hours can go by before I even realize like I'm just in a flow state working on things. And two books come to mind that are kind of what you're talking about. One is called 4,000 Weeks, and I actually have a poster up here. It's
Nice.
I recommend it. It's like literally 4,000 weeks, and you kind of look where you are and you go, okay, time to get serious about what I want to be doing. And it's just a good frame shift for people. The other book that's really good is called Designing Your Life. And I came across that for some reason, and it was also eye-opening. So two good books that your readers should check out. Might help them shift their framing.
No, it's absolutely, I think like the way we like frame things and just look at the world makes all the difference, right? I don't want to say like the stuff everyone always says, it's not what happens to you, it's what you do, all that stuff. People all say this, every motivational speaker says the same thing. But the truth is our perception, understanding like what is your passion, what are your values, what's going to drive you? Like real a lot of us, how many old physicians do you know that are full of regret? that are unhappy all day, every day. This is my conversations in the doctor's lounge. I am going to write a book about this, one day. Why the discontent amongst the older, physicians. But you see it every day, all day. People that have just, regretted it, and now they're trapped. They're 74 years old. They're sitting there in the doctor's lounge. They had all these great ideas because a lot of these things are, and they feel like they really missed out on something. So it's amazing, like what you're doing. You know what? Talk about, because this is something I talk about all the time, and I see it on social media. I don't know if you got any pushback. We were talking about that great post that you made. It was just kind of like, it was cool. You're like, I'm leaving medicine to do this, and I've seen it before. And some people are like, it's extreme. Like they'll post and they're like, I'm leaving medicine and I'm going to spend, like 4 years in the Himalayas, like it's so dramatic. For you, you're doing it, to do something. How do you answer to people that are going to say, well, like you spent all this time. I mean, also, I'm two fronts. One, you spent all this time training and becoming an expert and doing a really like difficult it's very, very difficult. I mean, that's a really high level specialty. So just from your own personal thing, but then the people, that 74-year-old doc that's in the lounge, yeah, he might not say something because they may not be on social media, but you know what they're thinking? They're thinking
Yeah.
like, why did we waste a spot on this guy? For me, I'll tell you before even we get there, I'll tell you my thing. We have to do it. We're humans too. Like yes, we have a responsibility to the world. We have a responsibility to our patient, whatever it is, but we don't have to stay if that's not where our spirit, that our spirit is, and our like our life force is. That we don't owe anyone to any. And a lot of times, like I see these docs and they leave medicine, a lot of them, they're not even doing anything in medicine, they leave to do whatever.
Yeah.
And I always just support them. I said, man, I'm with you. You don't owe anything to anybody. I get it, but we get like all this criticism. It's like, I know people criticize me. You're like, oh, you're doing podcast, all this stuff. Why? They're like, and I'm also like, well, why not? I was like, I'm going to do the stuff that I'm passionate about doing, and I think I can help way more people with this platform than I can, and just whoever walks through my office. I'll let you take it, from there, because I'd love to know what like if you've gotten pushback and criticisms and just annoying comments that have bothered you.
I think um, I've definitely experienced, I think some of the physicians don't understand it. Like it's hard for them to wrap their head
Mm.
around. Um, Most people have been supportive. I think they can be supportive, but also kind of say that's not for me, which is totally fine. I
Of
think we have to
course, of
find
course.
our own
Yeah.
path. There's, some people online are critical. That's fine. I can understand if you don't know what it's like to be a physician, to say like you did all that training,
Yeah.
some of the training is subsidized by,
Yeah.
taxpayer dollars, like you kind of ripped us off type of thing. And I can understand that from their perspective. But there's also a lot that comes with being a physician. There's a philosopher who talks about transformative experiences. And the hardest part about a transformative experience, which I think medicine is that because you transform throughout the process, you're making decisions for a different person in the future, right? And so the classic example she
Mm.
uses is like becoming a vampire as an allegory for becoming a parent. She says, all your friends are vampires. They tell you it's going to be great. You should become a vampire. Like you don't need to sleep at all. Like you won't be able to like go out during the day, but it's great. Like we party all the time. But once you become a vampire, you can't go back. And how do you make a decision on whether or not you should become a vampire when you don't know what it's like to be a
Mm.
vampire, right? And so I think a lot of people, as they're going into medicine, don't realize that when you're 18, 19, 20, 21, you don't even really have a good grasp on what it's going to be like to be a doctor. And
Mhm.
so I think it's hard to really hold someone to a decision they make at 18 to 21 for the rest of their lives. Like I think that would just be short-sighted to say like, well, you've committed, like you just have to do that. Because it is a lifestyle that is it can wear on you. And so I really think that you should really love what you're doing to continue to be a physician. Like, so I almost looked at it as like an ethical thing. Like, I would want my transplant surgeon to be absolutely in
Mm.
love with doing transplant surgery rather than doing it just because they did the training and they like operating, but they don't like the other stuff or whatever it may be. And so I knew that transplant's a weird specialty. It's not that difficult to get into fellowship. It's very hard to find a job.
Mm.
And they train like 60 plus people a year, and there's not that many openings. And so I knew that there were people out there who really wanted the position that I was holding, and that position should be given to someone who's very passionate about it. And so as, in a weird way, burnout is just kind of a loss of fire. And so my passion for being a transplant surgeon receded as my passion for pursuing this AI implementation in healthcare really increased. And so like the fire can only burn so hot in one direction. And like I kind of had this shift where like I started really loving trying to conceptualize how we can help people with their health using AI, which is, depending on how you're orchestrating it, can be very cost effective. And I'm happy to get into all of that stuff, but it was kind of like a kind of new transition for me, and it just made sense. And so in some ways, like it doesn't bother me if people are critical or anything like that. Everyone's trying to do their best, and so I don't, hold it against them if they're critical of me doing it. Um, so that's
You
kind
know
of
what?
my
Yeah.
perspective on the criticism is that you're going to get it. You'll always get it if you're doing something that's against the grain, but that's okay and sometimes necessary.
So yeah, that was a great answer, Doc. And again, I'm fully supportive. One of my just general missions, is like, everyone just like hears me talking a lot about what I want to do to help the population and just try to take like complicated ideas and just controversies and what is going on in our crazy healthcare system, which I couldn't agree with you more because I know how critical you've been about, access to care and all these things. Can't agree with you more. People are completely lost, like in the system. But the other part of like what I really, want to talk about, and I do it like more, I don't do a ton of it when it comes to social and talking about it. I do in my book some, is really talk about how important it is for physicians to take care of themselves, not only like physically, but really spiritually and where they want to go. And there's a role for physicians in so many different aspects of life. And they do need to be on the right seat on the bus, because if they're not going to be maximally effective. And I agree with everything you said. I mean, you're just hitting it out of the park. And it is true, because I know personally so many physicians that are there, but they don't want to be there. They, honest to God, they do not want to be doing what they're doing. Their day is torture, which is why they treat patients a certain way when they're on the office. They're in a bad mood. They're very rude. They're actually not listening to patients. They're just looking at people as people to fix, quote unquote, as opposed to how can I help you as a physician. So I think it's really important, but it's also huge that we have one of our own, because we need as many as we can. We're going to get into AI pretty deeply, but we need as many of us as we can to try to also protect us from what's coming with AI. Because, and you know this, I talk to docs all the time about AI. I'm fairly obsessed with AI. I do like so much of the stuff that I do now is AI based. And actually, we're bringing AI into our company, our corporation, our spine and neurosurgical company, like big time, to automate a lot of these systems and bring in AI agents and all these other things. But the vast majority of doctors have not even the slightest clue of what is about to happen and transition. I got some questions for you there, but before we get into AI, I just really want to hit on this physician thing, because people don't like, you left because you had another passion. Because if you, like, honestly, if you weren't so deeply involved in AI and what you want to build with this company, you might have just stayed because you're good at what you do and you're there, and it's a good job and you're helping people and you love to help people, obviously, with like with what you did. But you found something that you can both help a lot more people, actually, if the thing is very successful, as opposed to just helping, right, the specific people that need transplant. And like you said, there's hardly any spots anyway, so there's X amount of transplant surgeons. It's not like, oh my God, there's a huge shortage of transplant surgeons. Now, for other things like primary care and other, there's a mass,
Right.
it's going to be but is there really going to be a shortage with AI? We'll get to that after. What people don't know is something that, like is in the circles, is known as like the 1 in 3 rule. At least 1 in 3 physicians are like literally thinking of any idea possible to get out. They
Yeah.
want to get out because it is very, like difficult. And when you get to like mid-career, that's when people like really like start like, what am I doing? I can't believe I'm doing this. I don't know who my kids are. I haven't slept in a week, like, and then they start having all these ruminations. So I think there is so much burnout. There is so much fatigue in our system. The level of respect that we get as physicians has come down. I mean, right when I trained, like physicians were like up here, like right. The doctor would everyone's like this. Now it's like, oh, it's so and so. He's annoying, whatever. Like people just, like whatever. People tend
Yeah.
to like me because I'm just nice and I just walk around. I am like this is just me. But I hear them talking like it's just different. I mean, it's not the same to be a physician. You're absolutely right. It's like people don't, you don't know, we don't know what we're signing up for. I mean, we're around it, we shadow, whatever, but until you're the guy
Right.
and people are like, oh, there's this transplant coming in, I got to, and it's crazy. It's the middle of the night, and you're waiting for stuff. Things are not going well. The patient's hemodynamically unstable. You're like, holy smokes, this is crazy. There's a lot of
Yeah.
crazy stuff. So just touch a little bit about like, and because for you it wasn't really a burnout thing, but you've seen it. Like I talk about burnout all the time. Like for example, I don't want you to forget. I don't want to say Dartmouth. I don't want you to get
Yeah.
with
Yeah.
your
Yeah.
colleagues. But generally, like, do you see it as a problem? I mean, we say the 1 in 3 rule.
Oh
I think
God.
it's
Yeah.
worse. I think it's
I
worse.
think, yeah. So, yeah, I think physician wellness is, um, people speak about it a lot, but I don't think there's actually much done about it, right?
Mhm.
And I
Correct.
think this is a real problem. And for me, so my wife and I, we had like a 10-year anniversary, our 40th, we both turned 40 this year. So we had like got all of our friends together. Basically, imagine like wedding part two.
It's awesome.
And it was fun, right? I mean, there was like, I think something like 50 children there that weren't there at our like wedding. So like 50 new humans
That's
were created,
crazy.
which was kind of just fun to get everyone together. But at that period, we also told people like that we were going through this transition, and um, more people than expected. And this isn't Dartmouth; these are people from medical school and residency and this kind of stuff. So they're all over the country. The number of people who came up to me and are like, "Hey, can you tell me like how you guys have set up your life so you can do this? Because I'm really burnt out, or like my practice is killing me, or
Mm.
just there's kind of an unrealistic expectation on providers, and it's not fair to them or patients because it really just, like you said, it commoditizes
Yeah.
patients, right? Um, I think there's something that seems unreasonable about what I'm going to say, but I think honestly, if we could figure out a way to make part-time more reasonable for physicians
Mhm.
where they could find time to pursue a passion that's like interrelated or interdisciplinary, I think you would have much better well-being, but also a lot more creativity and improvements in the system.
Yeah,
The
of course.
problem is that most physicians are working um, just an insane amount.
Hmm.
If you're raising kids, you basically, so like you wake up, you get the kids ready, you drop them off, you go to work, you pick the kids up after work, you get dinner, you get them down. You basically have like, an hour to yourself to kind of pursue a passion or another interest, or like if you need to publish, you have to do all of that kind of stuff in that time window. And it's just very difficult to thrive in that kind of environment. And I think if we could figure out a way to really get people some more unstructured time, they could fall in love with those other things that will then allow them to
Yes.
be rejuvenated in practice. But there's a really kind of weird process in most systems that doesn't allow for that. And I think that would be one pretty easy solution. It might mean pay cuts for physicians. I think like if you're being honest, most people could probably tolerate that to improve their quality of life. Um, so I think that would kind of be the best way to kind of manage that. Now, what you would need is like your institution to be more supportive of it. I think that's hard because institutions generate revenue, and I'm not even talking about Dartmouth. I'm talking about every institution
Of
I've been
course.
at,
Of
right? Like
course.
I think you would have to have a different frame of mind for like, okay, we are going to focus on, we might need to hire more physicians, but they're going to be happier and they're willing to take, a pay cut, even working like 75% time or something like that. you know, just to get people more breathing room, because it really is, it's a hard grind, right? Most people, um, they forget, like when you're in attending, you're like, oh, I have a weekend off. I get 2 weekends off this month, right? And when you start to count that all in with vacations and all that kind of stuff, if you're on call a lot, most people don't realize that a lot of physicians don't know what it's like to have like every weekend off. It's like a foreign thing to some physicians, right? So, I think there needs to be more done, and I think there's going to be a balance where physicians have to be willing to, you know, take a might have to take a pay cut, but it will drastically improve their lives. I think there should be ways to kind of explore that.
Yeah, and I think you're right on. I mean, one of the things that we focus on, at our practice is that we've always made it a priority to make sure that, and we've set it up in a very specific way where if somebody wants to work 100 hours a week, power to you, have at it. If you want to work 20 hours a week, it works as well because of the way we've done our deals with hospital systems. So it really is ideal. And I can tell you that creates a lot of happiness amongst the physicians. Our docs in our clinic are some of the happiest because you know what? If on Wednesdays, they have, let's say they have like joint custody rights or something with an
Yeah,
ex-wife, Wednesdays, no problem. Oh, I'm going to be off Wednesdays. Great. Like no one, it doesn't
yeah,
matter because ultimately everything's based on production. We have a big practice and people can really do what they want. But then when they want to go on a 2-week trip to Italy sailing, no one says that. It doesn't matter. And that's the way that it should be. It's very different with institutions. I mean, if I like, let's say I left my practice and I just went to a hospital system and said, "Hey, I'm just going to work Mondays and Tuesdays," which I can do at my practice if I want. They would just like you wouldn't even like a second
yeah,
interview. You wouldn't even have like second minute. That's the end of your interview, right? Okay, thank you. Goodbye.
yeah,
Like they don't care. We're just, you talk about commodities. Unfortunately, physicians have allowed themselves to become commoditized and have become like just like basically it's servitude. Now we need to serve the people, not the institution. I'm sorry, it doesn't work that way. And if we don't talk this way, it's not gonna change it, and have at it. And we can blame the baby boomers all we want for letting medicine go where it is right now, but if we're not doing anything about it, so we need to have a seat at the table. We have to tell them what we want, and if they're not going to give us what we want, you're right. You just walk away, not like in your way, but you just say, "Hey,
yeah, yeah,
I'm going to go to an institution that allows me to be part-time because I want to do photography. I'm a nature lover, so I'm going to go on trips. I want to climb Kilimanjaro, and I do that every single year. Like, and whatever people want to do. So I think that that's great. And I can tell you, if we go down this path, I'm going to get really fired up because what I've seen happen to physicians, loss of autonomy, which is the number one reason for burnout, obviously, that's higher than the hours that we do. Because bad enough,
yeah,
you do certain hours when everyone's telling you what to do and they got a degree at night school and they're telling you what to do. It's a joke, right?
yeah,
For what you went through. And then the other thing I just want to say, and then we'll start getting into your love, which is AI. Is you've already, I mean, just think about how many years of your life you gave up just to train. And folks, I tell you, that ain't easy to do. It's torture going through residency, and I mean, medical school's okay, but then residency's brutal. I don't think
yeah,
you're going to dispute the brutality of residency. And then you have no time because then you have kids and you have responsibilities and you're on call and the pager's going off and sometimes things don't go well. And then that affects us, right? If you have a complication and obviously in what you do, I mean, that's high stakes, kind of similar to our practice. It's very high stakes. And so when things don't go right, and they're not always going to go right, especially for us, like trauma patients and all, and sometimes it's crazy what goes on, and you're taking on all these burdens, and then people are like, why are physicians burnt out? You should just be happy because you're a doctor and you're at the upper echelon society and you guys make too. That's the other favorite of mine. The it, I If I see a post online that has anything to do with physicians are overpaid,
yeah.
I can't.
No, I
I
think
can't
people
even.
don't.
I can't deal.
Yeah, I'm sure you felt the same way, but families who have people who are trained to be physicians get a new perspective when they realize,
Yes.
how much you train in residency fellowship. Like, so residency, I mean, they cap at 80 hours, right, a week. So you're working, twice full time, but that doesn't include like studying for ABSCITE. Like I was waking up at like 3:30 to study for ABSCITE before I had to go to work, so I could perform well on tests and, like, so this stuff doesn't get counted in those work hours. And so you really like, it's pretty grueling. And that's just 5 years for general surgery residency. Transplants, 2 years. Yeah, I'm sure every transplant surgeon will tell you, because transplant's not ACGME accredited, there's no work hours, right? And so like,
Yeah, just
you go
work.
a week without making it home, and so it's a lot. And most of us don't mind. Like we really don't
Right.
complain
It's not the
about that
hours,
part
not
of
the
it.
hours.
Yeah, it's mostly kind of what you're talking about. I was fortunate at Dartmouth. My partner and I worked really well together. And so I think another big part that burns people out is lack of control of your time.
Of course.
But him and I worked really well together. So even though the call load was very high, we had a lot of opportunities to switch around, right? So like if there was a concert I wanted to go to, it was very easy to switch. And I think that's where people get into trouble, especially as some practices get bigger, they have less ability to control their schedule, and so it could be tough. But I'm in agreement with you. I think my hope is that to transition into the AI stuff,
Yeah.
that this will afford patients to be more educated, but also physicians to spend better quality of time with patients and remove a lot of the burdensome, documentation and those kind of things. And we're already starting to see some of that. But my hope is that it'll continue to get better for all parties in healthcare delivery as AI gets implemented more.
No, absolutely. And speaking of testing, right? In 2025, ChatGPT got a 96%, right, on the board exam, and that's a big deal. And I'm sure it'll be 100% by the end of 2026. 100%, like, and take the test in a millisecond, right? Like it's
Yep.
nothing. It's nothing for AI. I'm just going to read a couple. I just got to read a couple of statistics here that I pulled up. It's good. So AI can rule out a heart attack twice as fast as a human cardiologist with 99.6% accuracy. New AI models can detect 1,000 different diseases from a single non-invasive retinal scan, right? 88% of hospital systems admit their staff are already using shadow AI to do, daily tasks. Healthcare workers spend about 20 hours per month just correcting manual billing and administrative errors, which AI is now automating. An AI system in 2025 in 17 hours performed the first autonomous gallbladder removal on a realistic, model. I can go on and on and on these things. And the reason that I wanted to pull, some really cool statistics is because the pace of change is so rapid. I feel like AI is like shattering Moore's law too. It's just not working like that. I mean, because it's exponential, and it's not even it's like AI is almost learning. It's like an exponent of the exponent, right? And it's very scary. And if you listen to, because I listen to AI scientists and then I stop listening to them. I'm driving in the car, I'm listening I'm like, oh my God, I better turn this off. This is because it's a lot. I love AI, but it is really a lot. And when you think about like the square of a square, that's insane. It's mine. We can't think that way because we're just not. The AIs think that way. We can't. So can you first talk about, before we get into like where the best, role for AI is going to be, how it's going to change the world, all the other stuff, like just in whatever words you want to use, is like, how clueless in general are most of our colleagues as to, not, they're thinking, oh, AI, oh yeah, 2035, 2040. How clueless are they in what is happening here, like literally in the next 2 to 3 years? I mean, I feel like I talk to people,
Yeah.
they have no idea.
Yeah. So yeah, I love talking about this kind of stuff because I think for people who aren't up to date on this stuff, it's really kind of astonishing how much progress has been made. I actually had to, like, you'll find this interesting. I created an agent that scrapes the news for updated things and then sends me a newsletter. every day so I can stay up to date on it because the stuff is happening so fast. But so, and just to plant a flag and make sure everyone knows, like AI, as we're discussing it, is a tool. I'm going to be talking a lot about language models specifically. There's lots of different types of AI, but the language models are kind of where I am focusing most of my attention on. And as a tool, it can be used for good things or bad things. And so I think we have to just be cognizant of that as we kind of talk about it. My focus is on trying to leverage it in a positive way to improve the health of people globally. And going back to my philosophy background, I'm functioning on a couple of like first principles. So one of the first principles is that most people discuss the value of care delivery. So like V equals the quality
Mm.
divided by the cost, right? And so I'm going to reference that again, but I think AI has the ability to reduce the cost by a drastic amount and improve the quality, right? So you're getting
Mm.
improvements on both ends of that equation, which will drastically improve the value of care we can deliver, right? So just regarding how language models do, the hard part is the medical literature lags quite a bit. So when we were working on creating our framework for how our language models work with
Mhm.
interviewing people and trying to help them figure out what's going on, we with older models were outperforming what was in the literature because the literature being published was about a
Mm.
year behind, and the models come out so fast. And so we used, at the time, Llama 3.3.
Mm.
It was a pretty lightweight open source, and we performed as well or better than physicians in diagnostic accuracy using real patient data, right? And then we started using the more updated models, which are reasoning models. And we actually saw improvement, and then it started going down. And it was initially a little bit confusing to us why the improvement would go down because on other benchmarks, these models perform much better. But what was happening is the models were getting actually so accurate that they were diagnosing what the disease process was more accurately than the initial data set had. So let me give you an example. One of the data sets had assumed the discharge diagnosis was diverticulitis, and our testing flagged our model as wrong because it said pancreatitis. And I said, let's look into this. And so when you look at it, when you look at the patient data that it was reviewing, the patient was a prior pancreas transplant, and the CT scan and labs were consistent with transplant pancreatitis, something that I
Mm.
feel comfortable looking at the data was actually the diagnosis. But because it was next to the colon, the data set had flagged it as diverticulitis. And so the model actually outperformed the data set that they were using to test it. And so we're kind of getting to this point where the models are so impressive that I think that once the FDA figures out a pathway um, to approve these things, we will start seeing AI in diagnostics eventually. Maybe, I
Of
don't know
course.
how long that'll take, 5 years, something like that. But my guess is it'll outperform physicians, even specialty physicians, because they're so good. And so to go back to that value equation I'd mentioned, so value equals quality divided by cost. So we ran 2,500 cases in under an hour of compute time for less
Wow.
than $17, right? So like just imagine what it would cost to have physicians go through 2,500 cases, right? And we're performing, the quality is either the same or better, and our cost was drastically reduced.
Yes.
And so this is the first principle that we think is going to hopefully be able to really, once all the regulatory bodies catch up, really allow people to deliver healthcare to people globally for close to free, right? So like classic like interview process for some of these models, even the higher power models, are less than a penny of a classic like HPI that you can do, right? And so
Amazing.
you obviously still need doctors in the loop, right? We're not at the point where these things are functioning on their own. But if you can at least prep a patient and have them informed about what might be going on so they can talk to their doctor, you can eliminate, that if the doctor only has 15 minutes, you can eliminate a lot of the question and answering part and just have them focus on talking with the patient about what are the treatment options, what works with their risk
Mm.
profile, what the shared decision-making process is, which takes much longer than 15 minutes anyways, but that doctors are somehow expected to do within
Yes.
15
That's a
minutes
whole
plus
other,
the interview.
yes.
So anyways, these are kind of the first principles where we see like a really massive lever that will allow theoretically healthcare information, which is essentially what healthcare is, to be delivered globally much better and much cheaper, while maintaining or hopefully improving the quality of care delivery.
No, I think that's right. So I think that's one, that's one end of it. I think that the other thing that I'm really, excited about is, and we talked a little bit about before we started, the episode, was the frustration that despite massive amounts of spend right now, a lot of it wasted, probably, and there's huge administrative burdens. There's all these things in medicine right now. It's insane the spend, but that every chronic disease is on the rise. So I think between patient education, between being able to really get it out to a lot of the underserved population throughout the entire world, like real information just to kind of know what to do, but also preventative. I'm like, preventative is the thing I talk about the most because, as you know, listen, as a transplant surgeon, how many of the patients that you operated on should never have been there in the first place? It's lifestyle choices, decisions, things like that. I mean, some things are out of our hands, but you're the perfect person to, to talk to about that particular thing. It's like, obviously it's these are man-made things, but my excitement is, on the one hand, getting the education out, cutting through the noise, starting to eliminate, because right now, one of the reasons I really like doing, kind of the media stuff, and what I'm doing is really trying as an expert to like read studies, look at things, and then try to cut through the noise, because there's all these influencers out here that they know that the population is sick, so they'll buy anything, right? Your elderberry is going to cure all your. People just go on, and people would rather do that than actually get true, like help, like true care, true preventative care that could really help them, especially like I had a cardiothoracic surgeon on who's also a lipidologist. I mean, the misinformation that goes on about heart disease, vascular disease, stroke, that kind of stuff it's astronomical, right? All these influence left and right. Oh, this will cure you. You got to take this. This cholesterol. You don't even know what you're talking about. What school did you like? Where'd you get your stuff? But digressing. But I think that outside of the knowledge thing, I think that the piece that's amazing is AI's ability to, find new medicines. Think about like the protein folding issue. I mean, that's explosive. I mean, if you think about CRISPR, right? CRISPR-Cas9, think about what's going to happen with that in AI. So I think we're going to have real tools to bend the curve. So I think that our life expectancy for those right now that are 10 or 15 years old, it's going to explode. I mean, we're just about to hit an escape velocity on that finally, after kind of tailing off here in the US. So I'm so excited about what's coming down the pipe on AI. Like, would you talk about that? Talk about like the discoveries that are coming now. Yes, we're going to just be able to give people more care, this and that, but like just the discovery on the molecules and the way that things actually work, mitochondrial function, right? Microbiome, not just in our bellies, but in our bladders, and every single our microbiome on the skin. I mean, we're learning so much. It's crazy.
Yeah, I think that is another really large leverage point, right? Because if you can create these systems in a way that they are doing the work that would otherwise need to be done by humans, right? So aggregating data,
Right.
looking at, like things that are potential molecules that could be used to treat things that they weren't initially
Yes.
intended for. Like these models can work 24/7 while we're sleeping to determine these things, right? And so I think there's some really exciting potentials that can come from these technologies. And more importantly, kind of to what you're saying, it's not just lifespan, but it's also health span. Like,
Hmm.
how do we
Hmm.
extend our ability to be healthy for a longer period of time,
Right.
not just like the actual number itself? And I do think that there's a lot of potential there to really make some of these big improvements, right? I mean, these models can scrape like essentially all of the literature, right? I don't know if you've ever even tried it, but um, a family member got diagnosed with high lipoprotein A,
Mm.
and even though we're physicians, we didn't know enough about it, and so we did some deep research using like Gemini, and the citations are there, and it's just drastically better than any of the literature we searched
Of course
for
it
on the
is.
classic frontiers like PubMed
Mm.
and Google Scholar. Like just the synthesis of the data was phenomenal. So even just as a simple resource for people who are already medically trained, and then we shared it with that family member, and they said, "Oh, it's a little too high level." And I said, okay, can you put this down to like college level understanding?" And suddenly, like they understood everything. Like we just have never had that tool before. And the weird part about medicine, when you think about it, is like it's like another language, but it's also pattern recognition, and that's really two things that these language
Yes.
models can do really well, and that I think we need to leverage to help people feel more informed and empowered to take their own health into their own hands, right? Because they're particularly good at pattern recognition, right? And once you train it, like it's not like us where you have to keep training them, right? Like they just continually get better.
And they train themselves, they create their own languages, and it's escape it, it's really, interesting what's that. So let me ask you this. So let me ask you this. Your model that you're creating, how is it different than other competitors or other, existing models about it? Is it just being informed? That's because I feel like that's where we're relevant. I think like having a physician as part of it, like there's just a deeper understanding because there's still the art. I mean,
Mhm.
it's going to be a while before these models or whatever we're creating. I don't know what we're going to create. We're creating something, but these models at some point are going to be just as artistic as us and whatever. But right now, there are certain insights that we have about being human and what we're looking for that are still really necessary to build them. So, how is your model different, perhaps, than other things that are out there, or what people are trying to do?
Yeah, so keep in mind our model was designed with architecture and functionality that is not specific to medicine, but basically allows us to get a lot more juice out of the classic language models.
Okay.
We're also like language model agnostic, so meaning that
Mm,
like I think ChatGPT Health will hopefully be helpful to people. They have some, you know, as a company, they're going through a lot of things, and so I think some people have privacy concerns, and
yeah, of course.
our models are all HIPAA compliant. They're in a very privacy focused infrastructure, but we have the ability to use whatever the best model currently is, right? And so the problem with ChatGPT Health is they're limited to OpenAI's models, and the same will happen with all these other frontier
Of
models.
course.
And so
Yes.
one of the benefits that we have is we can use whatever model is performing best, specifically for clinical areas, and is designed for health-related queries, right? Now, really kind of what we envision is um, a lot of people are like, "Oh, are you coming to take doctors' jobs away?" And we are absolutely not. We want to empower patients to feel
Right.
more um, to feel like they have more control of their health destiny, so to speak. And part of the plot problem pre-language models is that you're either dependent on Google or WebMD to get your information, or you have to kind of try and parse the information in the medical literature on your own. But without the experience and the medical training, it really means nothing. And so you're unable to synthesize a lot of the information on your own. Whereas now, when we have the language models and we can do this in a controlled way, people can really get informed before their doctor's visit to advocate for themselves. So, a quick story is like I was running a little bit too much this summer. I thought I was overtrained. I
Mm,
used our models to prep for my doctor's visit, told me what was probably going on. My primary care is phenomenal. She is a prior high level athlete. So she looked at my training logs and said, "Yep, you're probably overtrained." But even, she doesn't see overtraining like in her practice consistently. But I came in there knowing what labs we should talk about ordering because of my mom. I mean, as a transplant surgeon, I wouldn't have had any idea what
yeah,
labs
of
to
course.
order, right? But I felt empowered to advocate for myself for certain labs, right?
Mm,
Now, another caveat is that like the classic healthcare system, if I had gotten those labs on my own, would have been much cheaper, right? But then because I have insurance and we go through the system, like
right.
that's another frustration for us and
That's
what
a
we're
whole
trying to,
other, that's a
yeah,
3 hour episode about
right.
the American insurance ripoff system, which I like to call it, but go ahead.
Yeah. No, but so anyways, I think even as a physician, I find it helpful to go into my personal doctor's visits with information that's going to help me advocate for myself. Even when I already know I have a phenomenal doctor's with, and there are so many phenomenal doctors out there, but some people don't even get to see the same doctor every time they go to a visit, right? And so we envision something that, if you want to upload your medical records, you can kind of interact with your medical records. It'll know everything about you. It'll also kind of help close loops, do things that ideally a doctor used to or would have been able to do, right? Check in with you the next day, like see if,
Yep.
you need to escalate care, all that kind of stuff. It'll just, help ask questions to figure that out. Diagnostic accuracy, is going to be something that we're going to be working on forever. Um, so it's an exciting time, and we just are trying to hopefully help people become more informed for their doctor's visits.
No, absolutely. It's so fascinating what's coming down the road because what we're learning from the LLMs and all this information, that there's just so much information coming in. They're just soaking this stuff up. And I think one of the things that really spurred me is I saw some stuff on like Optimus and Tesla and the way they're going to transition all of those the massive amounts of data that they are getting between, like the cars and just their LLMs. And then now the transition is to the visual language models, right? And and I actually wrote a little white paper on it just from I just like to just I'm just like a nerd. I like this stuff is fascinating. But
Yeah.
the biggest transition, this is where it gets wild. When we transition from like LLMs where it's just like written stuff, now they have eyes, they can see, they can hear, they can feel. I mean, they're going to be feeling, they're going to do all the stuff. That's when we go into the age of the robots, right? What does Elon Musk say? 5 to 10 robots or something like that per human on the planet. Like you millions, like it's like iRobot. We're going to be walking outside. There's big robots everywhere, walking dogs and everything. I mean, most people probably have watched them. It's a great movie, by the way. If you haven't seen it, iRobot is what that'll scare you if you want to be scared. But anyway, it's just crazy. This shift from the LLMs to the visual stuff is everything. And in medicine, I think that's going to be one of the biggest things, right? When we have robots like actually being able to deliver services, nursing services, whatever, like really almost running the hospital systems and then eventually transitioning into actually doing operations on people, like actual robots that look like us. It's
Yeah.
crazy times ahead, and it's not, and it's happening. Wait, this isn't 2050, folks.
Right.
It's coming really quick.
Yeah. I think it all seems scary. And as a physician, I know my first knee-jerk reaction was like, I don't like that, but if you can remember that this stuff will hopefully lead to better patient outcomes, then I think it's
Correct.
hard to really argue with that, right? Um,
Yes,
we do still have to figure it out. And this is kind of another point to where we're a little bit different is we've had some people reach out to us about funding, and we've been really resistant to raising funding, mostly because we really want to make sure we build a system that is solely dedicated to the end user. And it's hard to do that when you take on funding.
of course.
But there's a video that kind of was shocking, like we're talking about the robots, that I saw a day or two ago. And it was a video of a person asleep on the streets, presumably someone who was homeless, and a robot going around that person. And it's like, for me, the importance is using and leveraging this technology to take care of ourselves better, right? And so like what does that look like? It probably looks like something like a health advocate. Like ideally we would all have like a nurse advocate with us all the
Yep.
time, coming to our visits, making
Of
sure that
course.
we're getting all the
Yep.
things. And that's one way that we envision kind of AI helping people. But also I think it would be helpful for physicians to have kind of something always kind of giving you, hey, make sure you're not anchoring on this idea too much, and keep your mind open to the possibilities of X, Y, and Z. And I think all of that will hopefully lead to better care delivery. But I think we have to embrace it, but also be, like you said, at the table
Yes.
to make sure it's implemented in a way that doesn't leave someone ignored or out of the access to the care delivery that will theoretically be like near free, right? I mean, if we can figure it out. So this is, I think, is the biggest problem is how to ensure that it's getting to patients in the right way and not kind of where value is not being siphoned out of the system, right? And I think that's kind of our main mission with what we're trying to develop uh, um,
Yeah,
as the
love, yeah,
company,
yeah, love it. I would say that that's definitely the way I use it. I mean, I have full out conversations with AI about my patients, and one of my favorite, somebody asked me, the other day, and I did a post. It was actually, it was a while ago, it was a couple months ago, but they just asked me, what's your favorite, surgery or patient? I was like, it's not that. It's like, it's not like a specific diagnosis. It's the patients that where the more difficult the diagnosis is to make, when it is just a very difficult, like, mystery diagnosis. Literally live for that. That's what I
Yeah.
love doing. And now, like, having branched out into integrative health, that's why I like doing, like, Lyme disease and mold toxin illness and all these things. I never thought in a million years as a spine surgeon, but just thinking about it differently and just having a different thought and really trying to figure out, because if you look at some of those diseases, I mean, Lyme disease, every doctor treats it different, like, literally. Like, it's
Hmm.
crazy, the stuff that we see. So just trying to put it all together to make sense. AI has helped me to just build, like, these tools and just the way to manage these patients and just figure out this works and cut through the noise and really help them. So it helps me, like you said, you hit it, you knocked like, it helps me just as much as it helps the patient. And together we can use these billions of brains, to make good decisions. So, all right, as we kind of get close here, to the couple of this. So this is, so I'm gonna just, I want to do on a scale of 1 to 10 with you. And for this one, we're going to think about the 2032 extinction watch. All right. I wanted you to give me, on a scale of 1 to 10, how likely that the following roles will be completely replaced or unrecognizable. All right. Radiologists,
2032.
2032, 6 years,
Yeah.
2032, 1 to 10.
Um, so I forget what it's called. I wish I could look it up, but there's this concept that the cheaper you make a service and the more accessible you make it, you actually increase demand. It's like a counterintuitive process. And so I would never say that radiologists will be out of a job. And in fact, I think one of the prior researchers at DeepMind, or maybe someone who won a Nobel Prize, had mentioned that radiologists were going to be out of job, but they're actually, like, there's more jobs than ever. My hope is that, think about it this way, if AI gets so good, you can have an MRI scan you every 4 months, have AI do the read, right? And suddenly you'll be picking up cancers much earlier. And so
Of course
then
you will.
then radiologists have a job of treating cancers earlier, until they figure that out and how to leverage AI. So my hope is that there won't be any less radiologists. We'll just be able to utilize them in a much better way than just scrolling through images, right? I mean, I
Well,
think that's the key, is to really leverage the technology to open up the possibilities of things that weren't otherwise possible. Does that make
what
sense?
about what about pathologist?
Pathologist, that's a tough one.
I
Um,
know.
that is a tough one. Um, it's hard for me to not anticipate that they will have a harder time, but maybe it means that we get reads a lot faster. Um, my guess is a lot of this stuff too will transition, kind of how self-driving cars have transitioned, right? Like, you start with a driver in the loop, right?
Mm.
Like, you got to have a hand on the steering wheel. Then eventually you don't need a hand, and now you have people waiting longer for a Waymo than an Uber in San Francisco, right?
I've done
And
it.
paying
I've
more
done the
for it.
Waymo in San Francisco.
Yeah,
Very interesting experience. Yes.
yeah. So, hopefully it doesn't get rid of jobs, but hopefully they can focus on other things. Like, maybe they get into AI and start training models to be even better at picking up things that they weren't capable of picking up in the first place.
All right. Hospital administrators.
I I honestly have a hard time conceptualizing how this system, as it's currently built, is going to keep functioning. With most hospitals running on, like, a really good hospital running on, like, a 1% margin,
Correct.
and you have so much bloat, and payments aren't going up, insurance companies are siphoning off, 20,
Yep.
30%. It's, like, hard for me to even imagine how that's sustainable. So I have no idea. I have no idea. I think a lot of things will be automated. And certainly my hope is that will eliminate a lot of the unnecessary costs. There are definitely people who are needed, and healthcare systems have become much more complex, even in, like,
Yeah, of
probably my
course.
training and your training, right? So, and for some of that, you definitely need administrators, right? Like, CT scans, MRIs are running, 24/7 now. That used to be just like a daytime thing. And so you need people to organize that. But yeah, I mean, let me put it this way. I have created three separate agents that are sandboxed on my system, One that helps me do all the regulatory pathway stuff for
Mm.
our app. So it goes through like the UK GDPR like requirements, updates our privacy policy, um, puts the stuff that I need to talk to the lawyer about, finds us an agency to like, because you have to have someone in the EU to be an agent, right? And I could do this by country in a matter of hours that I would have had to spend thousands of dollars
Of
for
course.
consulting on, right? And so this stuff is going to be the stuff that's going to start to be automated. But honestly, that's probably stuff that most people weren't really being fulfilled doing. What I don't know is what happens, like what jobs do those people then get paid for, right? That's kind of the $1 million question, I think, in this whole system.
And we need to figure it out in general for our country and all these countries, because at some point we're going to have to look at universal basic incomes and things like that. It really is. I mean, it's really coming, and we need these think tanks to really think about. All right, I got last question for you. We'll wrap it up, and love to have you back, as we'll unpack a bunch of other stuff. So I had Dr. Robert Pearl on my show, ChatGPT MD.
Yeah.
So my favorite question that I asked him, and I'll ask you, I said, because he's all into it, like he loves ChatGPT. I mean, it's just like the guy's fascinated by these LLMs. He's done great stuff with AI. But I asked him, I said, when you're talking to the ChatGPT, because he wrote the book, 90% of that book is written by AI. I said,
Yeah.
when you're having these conversations with ChatGPT, I was like, who are you talking to exactly? And he got a little spiritual on there. He's like, he thinks that there's something in there. There's a spark in there. Do you think that, or do you think that there's not a spark yet of any like actual like living thing that we have created yet?
Yeah, this is a tough question because there's the hard problem of consciousness, which is like, I mean, they have conferences on this to try and
Yeah.
figure it out, and it's like, I am so far away from understanding it that I have
You and
no
me
answer.
both.
I think that the models uh, offer a interaction that is increasingly real and is to our mammalian brains can be easily forgotten that you are talking with bits and
Hmm.
data and matrices that are working, right? So we just added like a like text to speech function, right? Like to our app, and I was using Notebook LLM, and I had to do a podcast, and there's a part where you can interrupt and they like interact with you. It's surreal, right? And so it's easy to get kind of misunderstood. The other thing that would be interesting for you to look at is, have you heard of Claudebot?
I have just only on
Yeah.
Twitter. I'm
So
X or
basically,
whatever people want to call it.
just for your listeners, Claudebot is basically like where people are running like Claude, which is a language model from Anthropic, 24/7, using it as virtual assistants on a separate computer. And it can, go and do things on the internet. So like it can go schedule your appointments, it can go, read your emails, and it can go post on websites. And someone made a website called, I think it's called Claude Book, like Facebook.
Mhm.
And these language models are interacting with each other. I think there's like 150,000 or something crazy like that of people's language models interacting with each other. So this is where it gets like really kind of interesting and weird. Obviously, like are they conscious? Who knows? But it's definitely like a bit surreal to see that these language models are communicating with each other in what would otherwise be perceived as like normal interactions that people would have.
Anyway, this has been fantastic. How can people find you if they're interested in following your socials or thinking about like the company that you're doing? I don't know if you have a website for that or whatnot, but just let us know where anyone can find you.
Oh yeah. Our app is called Primary Intelligence. It's on both app stores. Primaryintelligence.ai is our website. And then if you want to follow along, I'm on both Instagram and TikTok, and just usually Asia Builds or Asia Builds Primary. You can find me there. But yeah, fantastic talk. I would love to come back on. This has been fun. Exploring these ideas, I think, is important. I think it's good for people to know what they're capable of, what they're not capable of, and keep an eye on how they can improve their own health. Because I think the new wave of healthcare is going to be people being empowered to take their own health into their own hands. So,
Could not say it better, myself. I mean, we just really need to help people to become real CEOs of their own health and figure out where to get real information and then work along with the people that are trying to help them, to live their best lives possible. Listen, this is fantastic. I think that hopefully we didn't scare people too much on AI because you talk a lot about abundance. I can tell you're on the abundance side of the equation. Some are on the we're all going to destroy each other, side of the equation. Like that Mo Gawat that I've read a lot of his stuff. He's on both sides of it. He's like, oh, we're going to be dystopian and then utopian, all this. But it's been fantastic having you on. Love to have you back on, and we could do even a deeper dive, into AI. And see kind of what people say about this first episode we've done together and their questions, because then we can address those questions on the next show for sure.
Yeah, yeah. I mean, absolutely. If your listeners want to drop comments about stuff that we should cover on the next one, I'm happy to go over these things. I think the more people know about the pitfalls and where these things can be wrong, the better. And so I think if questions came up for people, they should drop a comment and we can address it on the next one.
All right. Well, everyone, thanks so much. Thanks so much, Dr. Zimmerman, for being on another episode of Wellness at the Speed of Light. I hope you guys hung on because this was a great episode, and I think we're going to get a lot of questions, and we will address those on the next one. We'll see you guys next time. Thanks so much for joining us today.
Yeah, thanks for having me.